Despite the partial shutdown of the federal government, new health care insurance exchanges opened for business today, the most ambitious initiative of President Obama's signature legislation, the Affordable Care Act. So how did things go on this inaugural day for those state and federal online and telephone marketplaces? Bertha Coombs joins us now from one of the busiest, the call center of the New York Health Exchange in the state's capital city, Albany. Bertha?
Tyler, officials have been saying all along, expect to see glitches on the early stages of this open enrollment process on the exchanges. Well, they certainly weren't wrong. We saw plenty of them today. Maryland couldn't come up. Hawaii couldn't come up on time today. And a lot of people had trouble logging on. Even so, we still saw here in New York, officials say some 10 million visitors to the site. Not necessarily unique visitors, but that gives you an idea of the kind of volumes they were seeing today. In some cases, more volume than they could handle.
New York State's call center handled more than 2,500 calls, and its exchange website more than 2 million hits during their first 2 hours of operation.
Well, we certainly anticipated that there would be a very high volume. 2 million hits in a couple of hours honestly exceeded even our estimates of the initial need.
While New York scrambled to add server capacity, Maryland officials struggled with connectivity issues which prevented the state's health connector from going online until noon. While there were no major problems reported with Colorado's exchange, some residents there still preferred in-person information.
Coverage, of course, would start January the 1st, and we're going to see if you qualify.
Okay. Once we help you apply, we'll go through the process with you online.
In Texas, one of 36 states with a federally built exchange, residents had better luck trying to get information on the phone and at in-person information centers than online. Kimberly Heacock got the answers she needed at a health center after finding she could not log on to healthcare.gov.
The website was overwhelmed, so we couldn't get on the website to find out actually how much it would cost.
What's key now is getting those issues resolved over the next 2 months, when enrollment applications are expected to peak for the January start of coverage.
Our systems folks are able to have capacity added to the system. They are there's a technical group of experts that are monitoring the performance of the website and will adjust it as needed.
Federal officials say some 2.8 million people logged on today on healthcare.gov. That's the federal portal for all of those states where they built the exchanges. And imagine if they'd actually had better capacity. It was very slow. They might have had even more people logging on. But what everyone continues to say, this is just the opening day of what is going to be a marathon. Back to you.
Thanks a lot. Bertha Coombs reporting from Albany, New York.